Thank you, Supervisor Cox, and thank you to our public health doctors who are here today. Today's actions represent a continued escalation in our response to the COVID-19 outbreak in proportion to the continued escalation of the numbers. We do all operate under the assumption that the numbers that we have available are lower than the actual impact because of the limitations in testing, limitations we are working fiercely to try and bring more online. But I think it is really important to reinforce to the public that when we lower public gatherings from 50 to 10, we need folks to heed these warnings. When we say even gatherings of 10 or less need to maintain appropriate social distancing, we need the public's participation and help in these efforts if we are going to truly flatten the curve and do our very best to preserve the integrity of our healthcare system. I know of particular concern surrounding the impacts of COVID-19 is the impact on our unsheltered populations and communities, and we have been working very hard to come up with systems and processes in place where we can help mitigate the impact of this on those homeless individuals throughout San Diego County. We had a sector call today with homeless providers and with those involved in this to share information, and we wanted to update the broader public. To date, 277 hand washing stations have been requested by jurisdictions throughout San Diego County. Both cities, along with state parks, transit agencies, and other entities. Of those, 187 have been placed. The remaining 90 are in process and will be placed shortly in due time. We also have the capacity, as we get additional requests, to continue to fulfill those requests. We have public health nurses in our 4 bridge shelters. We are moving to get public health nurses into other shelter locations throughout San Diego County, and we will keep you updated as we do that. We have public health nurses currently in 7 homeless outreach teams. We are in the process of expanding that to 9 additional homeless outreach teams, which will, once that's fulfilled, give us public health nurses in 16 homeless outreach teams. The aim of these individuals in the shelters and the aim of those that are in the homeless outreach teams is twofold. One, it is to provide information, to provide hygiene information for the homeless outreach teams. It is to provide hygiene kits. It is to make our unsheltered communities aware of what they can do to protect themselves and help themselves. But secondarily, it's to identify unsheltered individuals who are exhibiting symptoms or signs of COVID-19, and then to be in a position to get those individuals out of a congregate care setting, out of an encampment, out of an area where they are around other individuals. And we do that via the motel rooms that we have secured. To date, the County of San Diego has 1,472 motel rooms available. Individuals are beginning to fill these rooms, and in the coming days, we will be able to report on the occupancy of these. There are various locations across the region, and we appreciate our partners in the tourism industry for stepping up and making these available. We've prepared a chart to walk through the categories of these rooms and how individuals can access them to provide greater clarity towards what we are doing. On the chart, you will see that these rooms are not just for homeless individuals, and this is a really important point to make. The rooms that the County of San Diego has are not just for the homeless. The rooms the County of San Diego has is for individuals who have tested positive, who are a person under investigation, or a person exhibiting symptoms who does not have the ability or the capacity to self-isolate at home. So this could be a senior citizen who lives in a senior home who doesn't have the ability to go home if they're showing symptoms, but we don't want them to remain in that place. It could be an individual being discharged from a hospital that doesn't have the ability to go home. It could be someone who lives in a one-room apartment with 6 or 7 other people. Or it could be someone who is unsheltered. But these rooms are available for individuals who have tested positive, for individuals who are a person under investigation, or for individuals who are exhibiting symptoms to make sure that we can get them in an environment where they can isolate. So on the chart that we've laid out, you will see this is people needing isolation assistance. Positive, pending results, or symptomatic. They'll be evaluated by a physician or a nurse practitioner who have ruled out other diagnoses. They have to be able to maintain activities of daily living. What that means is these individuals have to be able to feed themselves and bathe themselves and generally care for themselves. The intake for these individuals will be through the County of San Diego temporary lodging call line, and the services delivered will be provided by the County of San Diego. These services involve transportation, meals, laundry, cleaning, room maintenance, along with daily phone wellness checks to make sure that they are doing okay. We are sharing this information with the medical community so that they have it. The second category is individuals who are homeless. If the individual is unsheltered or sheltered, they could be sheltered in one of our bridge shelters or they could be on the streets, and they are showing symptoms, they are symptomatic. The public health nurse who evaluates them and determines that they have symptoms will give them the opportunity to leave and go to a motel setting. They also have to be able to maintain the activities of daily living. The intake in this will be through the County of San Diego, our public health nurses who are on site, along with the temporary lodging call line, which has been provided to our homeless providers, along with our medical community. These unsheltered individuals will go to a motel where they will continue to be assessed and monitored for the appropriate level of care that is important. The Regional Task Force on the Homeless has a separate category of rooms that they are administering. We are paying for them initially. They will likely acquire some on their own that they will pay for. But as of today, we are taking 100 rooms out of our inventory of rooms and allocating those to the Regional Task Force on Homeless. The Regional Task Force on Homeless can put anyone into these rooms that they determine needs a motel room and shelter. Their priority will be individuals who are 65 years or older with chronic medical conditions, compromised immune systems. They have identified a listing of these folks who match that criteria. They will be an outreach to them. They will transport them. For these 100 rooms, the County of San Diego will continue to pay for all the services that I have outlined. The Regional Task Force on Homeless in the state of California may secure additional rooms that will be in these categories. If they do that, then they will be providing those services. We will also continue to assess our inventory of rooms. It is very important that in San Diego County, we maintain space for individuals who are positive, persons under investigation or who have symptoms, who don't have somewhere to go. We want those individuals to have a place to go. We also want to ensure that we are offloading rooms as appropriate to the Regional Task Force on Homeless so that they can begin to fill those. And the essence of this system working, particularly for the unsheltered population, is our public health nurses who will be out there. We've been working closely with Bob McElroy and other shelter providers who are here. Our nurses will be on site. They will be there to screen individuals as they come in. I appreciate Bob's patience as we've worked through this and his cooperation and collaboration. Bob has committed that as individuals leave and a bed is available, he'll be willing to take a new individual into that bed, provided that we screen that individual upon entry for symptoms or for services. I also want to point out that the gathering space that was outlined today, there is an exemption for homeless shelters in that they do not have to adhere to the 10-person for mass gatherings because that's simply not the nature of the way homeless shelters work. But we are requiring our shelters in the food setting type environments and anything outside of the birthing area to limit those gatherings to 10 and ensure social distancing. So we understand that in the broad shelter environment, you can't have it limited to 10 and you can't do that. But in those feeding areas and those other activities outside of the core birthing areas, we need you to limit those to 10 per person, and we want to ensure that we're maintaining social distancing. So again, of the rooms we have available, the county has one category for general folks needing isolation assistance, also homeless individuals who have exhibited symptoms. We are giving Regional Task Force on Homeless 100 initial rooms. They will fill those for individuals who have no symptoms, but have underlying health conditions or ages, and we will continue to all work to acquire more capacity and more rooms in this environment. And then in closing, I think the advice and guidance that's being given today is something that all of us really have to take to heart. The reality is that we are escalating the measures that we are asking the public to take because the situation is escalating, and we are concerned about preserving the integrity of our healthcare system. I remember in Marine Corps training being told one time that we were being trained and asked to do things in an effort not only to make sure that we weren't injured or killed, but to make sure that our failure to do what we were asked to do didn't injure or kill someone else. And so we're asking the public in San Diego to please heed this advice and warnings. Because although you may not be worried about the impact on yourself, your failure to follow these steps could be the thing that impacts someone who you love and care about. And we all have within our power the ability to slow the spread of this and the actions that we take. When we choose to do proper sanitation, things like hand washing, when we choose to avoid mass gatherings. right? When we choose to come together as a community and work to slow the spread of this, we can have a tremendously positive impact, and we can get through this in a much stronger position. So we're thankful for all of our public health experts, their tireless work and everything they're doing, along with all of the folks out in the community who we're working with every single day to try and tackle this issue. And we will continue to provide future updates as needed. Thank you.